Hi, good morning. My name is Dr. Saleem Husain. I'm an interventional cardiologist at JFK Hackensack Meridian Medical Center. I'm the director of the cardiac cath lab and the chest pain center there. And today I've been asked to come here for the Walk for Health. This is an ideal day to do this because it is February 1st, and February is Heart Awareness Month. And it's my privilege to come here and talk to you about things about heart disease, such as prevention, what to be aware of, what type of things that you should be aware of in terms of heart disease, and what the benefits of exercise and good health is in terms of maintaining a good lifestyle in terms of cardiac risk factors. Heart disease actually is number one cause of death in the United States. Approximately 18 million people have coronary disease. In the United States, the incidences of death is the highest from coronary disease of any disease, including cancers. There are many things that we can do in order to modify our risk for heart disease, and a lot of it is the way we take care of ourselves, our health, and what we can do to modify our health in terms of long term. So what are the risks that are involved with heart disease? Risks that are involved is a sedentary lifestyle, a bad diet, high fatty diet, cholesterol, poorly controlled diabetes, hypertension, smoking, also being very inactive, like the first thing I also mentioned, and the last is the family history. A lot of these factors are very modifiable. In other words, you can do things in your life to change your risk. There's a couple of them that you can't do much about. One is your family history, but the other ones are all modifiable risk. And being active, exercising is a great way of great way to reduce your risk of heart disease. Things that you do to prevent heart disease. First of all, the most important and one of the worst thing you can do for yourself is smoke. So smoking is one of the key things. What we see, especially in a younger population who comes with early heart disease, they tend to be smokers. And that is a very preventable thing if you can do that, and that's something that we do to ourselves. The other thing is adopting a very healthy lifestyle in terms of what we eat, avoiding a lot of fatty foods, a lot of fried foods, a lot of foods that can increase your cholesterol and so forth. Managing your stress is also very important. So if you have a very stressful life, exercise is a great way of relieving stress. So exercise is also very important in maintaining and trying to reduce the risks there. Exercise, staying mobile, staying active is a very important thing. As you burn calories, as you get more energy, as you sort of stress your heart and condition your heart, the heart is in better shape and is able to do more activities, and overall your risk is decreased by doing these things. So again, all those things. Also staying very active and healthy also helps reduce your body weight. You want to stay slim and thin. You don't want to be overweight. Unfortunately, a majority of the population of the United States is overweight, and that is one of the major risk factors for heart disease. Exercise itself is a medicine, and the recommendation is about 2.5 hours of aerobic exercise a week and about 2 hours of some type of strength training. Aerobic activity could include low-level activities such as exercise on a treadmill, could be just a brisk walk, could also include some type of aerobic activity, could be a treadmill, could even be simple things such as gardening, vacuuming your house. All these things are included as things of moderate exercise. And what the goal is to do at least 2.5 hours of that. Then there's another 2 hours what you do is strength training. And strength training would involve things that would involve increasing your muscle tone, stretching, such as yoga, tai chi, maybe band therapy or band things in order to help stretch yourself. So really the goal is to stay active. And that is really key. My real theme is really what I always tell my patients: the rolling stone gathers no moss. In other words, the more sedentary you are, the more risk of you having heart disease. You know, coronary disease is like a moss. It builds up in your arteries. The more active you are, the less likely that you're going to get problems with plaque development and so forth. So the more fit you are, the better you are, and that's why it's very important to be very health active and be active in your life as you progress.